Good morning, New England Fed, and welcome to this month's webinar on the avian influenza virus in felines. Please take a moment to introduce yourself in the chat and let us know who you are, what organization you're with, and what state you're with. We are really excited about this webinar today. We had a lot of people asking for some coverage on this topic, so I'm really glad that we were able to find someone to work with us. I'm going to go through just a quick few housekeeping items, and then we'll jump right into it. So I'm Crystal Arnott. I'm a board member of the New England Federation of Humane Societies, and I'm the executive director at Lowell Humane Society. I have fellow advisory board member and Connecticut Ferret Association's Vanessa Gruden here with me, moderating in the chat. So if you have questions throughout today's presentation, please go ahead and put them in that chat. We're going to put them all together and we'll cover all the questions at the end. I'd like to take a moment to thank our webinar sponsors, the ASPCA, VCA Animal Hospitals, the Humane Society of the United States, MSPCA Angel, and our possum partners, Save One Soul Animal Rescue League. Without these sponsors and these amazing partners, we just would not be able to bring all of our webinars and our annual conference to you. So thank you to them for helping us make this possible. I want to just highlight a few things we have coming up. Next month's webinar will be on Pan-Luc and how your shelter can prepare. We'll be hearing from Lauren Fitzpatrick from the Animal Rescue League Boston. We're going to skip the holidays. We'll skip December. We think everybody probably has enough going on. And in January, we will bring innovative programs, Pause to Adopt and Dogs on Demand. These are programs from Maui Humane Society, and we have 3 of their staff that will log in to tell us more about these programs. They're really fun programs, and I think it's a nice way to kick off the new year. And in February, we will come off of the holiday season and talk compassion fatigue. We'll be covering the foundations of compassion fatigue and how you and your teams can really watch out for yourselves as well as each other, because we all know this field is really difficult. So we're happy to be able to bring Jessica Dolce to that. If anyone's ever heard of her or been on her website, she's an amazing resource right here in New England. So come and check her out on February 12th. And then, of course, our conference is going to be in the spring in March 24th through 26th. We will be in Boston this year. Well, outside of Boston, we'll be at the Boston Marriott Burlington. And I hope that we will have a number of you coming to that again, where it's really gearing up to be an amazing conference. We will be releasing the schedule and have scholarship opportunities opening up soon. So pay attention to our website and make sure that you log in and keep an eye out for when those registration opens up. And I would be remiss if I didn't let you know that our merch is up on our website. You can check out our Fed gear on Etsy. We have amazingly soft sweatshirts, long sleeve shirts, tank tops, and anything that you could ever ask for with the New England Fed logo on it. The sale of these also helps us to bring the conference to you each year, and it covers those costs and helps us keep our ticket prices low. So, head on over and pick up something nice to wear out and about this winter. And without further ado, I would like to introduce our main event. Again, we have, oops, sorry, I'm just going to stop my share here. We have avian influenza virus in felines with Dr. Kristen Coleman. Dr. Kristen Coleman is an infectious disease researcher with a specific interest in airborne transmission and zoonosis of respiratory viruses. She currently serves as an assistant professor in the Department of Global Environmental and Occupational Health at the University of Maryland School of Public Health, and she is an affiliate faculty member in the UMD Department of Veterinary Medicine. Dr. Coleman champions a One Health approach to understanding pandemic respiratory virus transmission and has performed infectious disease research in multiple countries, including Singapore, Malaysia, Vietnam, China, and the US. She is passionate about human and animal health and enjoys fostering and adopting kittens. So Welcome, Dr. Coleman, and thank you so much for joining us today.
Thank you so much. And thank you to all of the New England Fed for inviting me today and all of the attendees for joining me. So let's get started. Basically, I am very interested and passionate about cats and also dogs. I have one dog whose name is Tiny, and I have several cats. I fostered a lot of them over the summer, and I had a few foster fails. So now I have a few kittens that I've adopted, and they might make an appearance in the background here during my talk at some point. So don't mind them. Okay, so the title of my talk is Avian Influenza Virus and Felines and the potential zoonotic risk to humans. So I'm just going to give you an outline of what I'm going to talk about first. So I'm going to give a background, just going to very, very briefly discuss what is avian influenza or bird flu, and the history of avian influenza and felines. And then along the way, I'm going to lead up to our current situation, what's happening now in the United States, and then dive into preventative measures that you all can take to protect yourself and your pets from avian flu. And then I'm going to discuss some follow-up research plans that I have moving forward. Okay, so what is avian influenza or bird flu? I'd like to see a show of virtual hands or maybe something in the chat of how many of you are familiar with avian influenza and have had experience dealing with it, in whether it was a backyard flock or in a poultry facility. Basically, avian influenza is just bird flu. It's a disease caused by a contagious virus originating from wild birds. And the USDA classifies it as either low pathogenic or highly pathogenic. And this is based on specific genetic traits and severity of disease caused in poultry. So the first outbreak of highly pathogenic avian influenza in the United States poultry dates back to 1924 to 1925. Where it caused a lot of bird losses in a live bird market in New York City. And the United States has been dealing with high path avian influenza virus in poultry ever since. But did you know that avian influenza virus is now widely infecting mammals? So a highly pathogenic avian influenza virus panzootic is underway. So what's a panzootic? So a panzootic is a widespread outbreak of a disease affecting several kinds of animals. It's kind of similar to a human pandemic, but with animals. So it's an animal pandemic. And a lot of the responsibility lies with this new clade. So there's a recent emergence of H5N1, and that probably sounds unfamiliar to some of you, or maybe it sounds very familiar to some of you. But that's basically a subtype of influenza virus, and a specific clade known as 2.3.4.4b has emerged, and this has accelerated mammalian infections and transmissions. So this specific clade is responsible for a lot of what we're seeing going on in the United States today. So this is a nice graph from the USDA showing detections of high path avian influenza H5N1 in mammals. So I don't know if my screen is covering the title here. I'll just move this down. But you can see, since this talk is about felines, you can see all of the squares represent felines, and the black squares are domestic cats. So you can see that this virus is affecting felines all across the United States. And this is likely just the tip of the iceberg. So these are just confirmed detections from the USDA. So you can imagine how many more infections are happening under the radar that we're just not catching. So everybody's probably familiar with the ongoing outbreak in dairy cattle in the US. And so that got me interested in the domestic cat population, because one of the main things that happens first, that's an indication of something wrong on a farm, is farmers, they're finding their cats dead from avian influenza virus. And the thing is it's not only infecting domestic cats, it's infecting also endangered species that are captive in zoos, and as well as some wild feline species. So according to the USDA, from May 2022 to present, there have been a total of 87 feline detections. 53 of them have been domestic cats, 9 bobcats, 23 mountain lions, and 2 endangered species. So 1 Siberian tiger in Nebraska and 1 Amur leopard in New York. And this is significant because this is the most critically endangered species among all leopard species. So this is highly interesting to organizations like the World Animal Organization and other organizations that work to preserve critically endangered species. Now, speaking of surveillance and detections, the first outbreak among felines of avian influenza virus among felines happened in 2003. And this was among a bunch of captive tigers in Thailand. So this was a devastating outbreak. And that's kind of what kickstarted our knowledge that cats can be infected with avian influenza virus, and it's deadly. But the problem is that we don't have a surveillance system in place. So we don't really know how often this is happening. So my PhD student and I, so his name is Ian Bemis, and I will show you a picture of him in a bit, but he's an excellent student and he's very sharp and he has a degree in animal sciences. And him and I are both interested in feline species. So once the cattle outbreak started, I was really concerned that, this virus was going to get into the cat population. So I started writing a scientific literature review. That's basically where you read through all of the literature that reports infections of avian influenza virus in felines. And so it takes a long time to sift through and read all those papers. But to me, I'm so interested in it, it's worth it. And there's a lot of knowledge gaps there that I noticed. So only 5 of the 53 domestic cat detections on the previous slide are actually reported in the scientific literature. So what does that mean? Why is that important? Well, it's important because we don't have the details of where these cats were potentially exposed. Did the cats die? How sick were the cats? What were the symptoms? All of that information is important, and especially, were they in the vicinity of a farm? Were they in the vicinity of a poultry farm? Were they in the vicinity of a dairy cattle farm? We just don't know that information, and that's information that's very important. So there's incredible knowledge gaps in this field. And so this is a picture of me and Ian Bemis. He's my PhD student. So we are the ones that set out this spring, I think it was in May, to begin writing this literature review. And we are still in the middle of it. So I'm just presenting to you today what we have found so far. So the number of publications reporting avian influenza virus infections in felines has skyrocketed. So you can see in 2023, there was a spike there. Oh, this is all feline, so it's not just domestic cats. But if we zoom in on just domestic cats, we see that in 2023 and 2024, there's also a drastic increase. Now, you might be alarmed by this 2008 spike here. This was due to a report from Indonesia, where there were a lot of domestic cats that were allegedly positive for avian influenza virus, but the official reports of this outbreak are difficult to find. But that's where the 2008 spike comes from. But you can see it's quite alarming that obviously there are more instances of this happening, and it's reflected in how many cases are being reported in the literature. So if we divide this up by feline species, we see that 209 of the total cases that we've identified were in tigers. And this is the number of tigers is represented only by a few outbreaks. So one of the outbreaks was very, very large in Thailand. And it's the outbreak that I mentioned was the initial outbreak in 2003. And then you can see the majority of the cases are actually domestic cats. And this is likely an underestimate, and it's especially likely an underestimate for all the other species, because domestic cats tend to get a lot more veterinary care than wild animals do, because of their relationship with humans. So I wanted to know what's going around the world, not just in the United States. So we looked and we see that it makes sense that the number of publications is reporting these infections is highest in Asia, because avian influenza is a big problem in Asia, and it actually originates in Asia. So this is something that would be expected. But you can see that Europe is having issues, as well as North America. I mean, it's just all over the world. So when we talk about avian influenza with in respects to its pandemic potential, well, it's already a panzootic. So it's already causing infections in animals, including birds and mammals around the world, and occasionally humans. It's really only a matter of time before it does cause a human pandemic. But right now it is causing a pandemic in animals. So the influenza virus fatality rates in felines are quite alarming. So among the 392 PCR confirmed cases that we identified in the literature over the past 20 years, the overall case fatality rate was 63.2%. That's very high. 382 of these cases were H5N1, so the high path H5N1. And 111 of those were the specific clade that we're dealing with in the United States, so 2.3.4.4b. And the specific case fatality rate for that clade is even higher, 68.5% is what we calculated. So this clade has potential to cause devastating impacts to the feline population. The symptoms are largely respiratory and neurological. These were the most common illnesses that were reported in the literature, and it often resulted in death. Now, it resembles, in some circumstances, it resembles rabies. So a lot of our counts that are reported by the USDA and others are probably probably an underestimate, specifically because this illness can be confused for rabies. And you treat the illness the same as you would a rabies incident. So you euthanize, and you really have to do post-mortem tests to identify avian influenza virus. And those tests are just not done, largely because your typical veterinary clinic doesn't have a test to test for avian influenza virus in felines, or dogs. Dogs are also susceptible, but seemingly less. So a lot of these cases, they're just not being identified and not being reported. Can also cause blindness. So this was reported recently in one of the reports. I think there's one of two so far that have reported cat infections recently in relation to the dairy cattle outbreaks. But one of them reported blindness in the cats that actually drank the raw milk containing very high loads of the virus from infected dairy cattle. And so this suggests that perhaps exposure route and dose might impact the disease presentation and severity. So you may see one cat who has relatively little symptoms versus another cat who looks like it has rabies. But the subclinical infections, there have been some of them reported. And what I mean by subclinical is that either they're completely asymptomatic or they're just not showing strong enough symptoms to be noticeable. And so this warrants follow-up serological testing for antibodies to avian influenza virus in the feline population because we just don't know how many have been exposed. And such studies will help us understand how vulnerable the population is. So how immune is the feline population to this virus? Have they been exposed and are they now immune, or are they completely naive and vulnerable to this pathogen? So these are the types of studies that we really need to do because we really don't know. So speaking of potential route of infection and the severity of illness, let's dive into transmission. So there are multiple routes of transmission that are possible. So I call this cross and interspecies transmission. So cross-species transmission is from one species to another, and then the interspecies transmission is from the same species. So it would be feline to feline. So first, let's talk about bird to feline. This was the most commonly reported route in the scientific literature over the past 20 years. Felines, they prey on wild birds, so it makes sense. Basically eating dead pigeons, chickens, and other birds, as well as contaminated raw chicken feed. Those were basically how the route of infection was reported. What was how the route of transmission was reported. It was by eating these dead chickens and then also being fed raw chicken feed, which I think in Europe is illegal to do, but I'm not so sure that I don't think it's illegal to do that in the US. So that was often implicated in domestic cats, and then as well as a wild feline species, so including the captive tigers that I mentioned before. So speaking of diet, there was a study done a while back, a few years ago, that showed an association between African mammals' diet and their exposure to avian influenza virus. So 21% of carnivore-derived serum samples, so blood samples, were seropositive for hemagglutinin. So hemagglutinin is the surface protein in avian influenza virus. So 21% of the carnivore-derived blood samples showed antibodies for avian influenza virus. And 44% of them that commonly prey on birds, these are like jackals, caracals, honey badgers, were seropositive, so even a higher percentage. But in contrast, when they looked at herbivorous species, only 5% of the herbivorous species samples were seropositive. So this demonstrates a strong association with diet and exposure to avian influenza virus. So this underscores the importance and risk to felines to become infected with avian influenza virus because they are carnivores and they prey on wild birds as well as wild animals like skunks, mice, that have also been shown to be impacted by avian influenza virus. So going back to the herbivorous species, in contrast to that previous study, there's been a more recent study that was published by a colleague of mine in Singapore, Dr. Gavin Smith, They did a serological study in Pakistan among goats and sheep, and they found that a decent proportion of them, 27% and 24%, were positive for clade 2.3.2.1c, and the clade we're dealing with now in the United States, 2.3.4.4b. Now, this is significant because the first known cases in US ruminant livestock were among newborn goats infected with this clade in February 2024. And shortly after that, we started seeing reports of this virus in dairy cattle. So that leads me to dairy cattle to cat transmission. So this was reported recently. It was an early release publication in the Journal of Emerging Infectious Diseases, which is a journal by the CDC, demonstrating the infections in domestic dairy cattle and cats. In this study, 2 domestic farm cats were fed colostrum and milk from avian influenza virus infected dairy cattle in Texas. So these were the 2 farm cat cases I mentioned that experienced blindness. So this is happening now. This is a new route of transmission that we were unaware of. And largely because we didn't realize that avian influenza virus was infecting dairy cattle in the first place. So to date, I just looked it up this morning for the talk. There are 296 US dairy farms in 14 states. This is a cumulative number impacted as of today. So you can imagine how many farm cats and stray cats there are that are vulnerable to infection, because this is a very large number of dairy farms. And a lot of them do have cats running around. Oftentimes, the first indication, as I mentioned before, of an outbreak on a dairy farm are the sick and dead cats, unfortunately. And then there's a lot of studies that report an unknown route of transmission. So they don't have any evidence for any specific route of transmission. And most recently, the Colorado Health Department has reported several H5N1 cases among domestic cats, of which 2 are indoor-only domestic cats with no known exposure to infected animals. So what's going on there? How are these cats getting infected if they're not being exposed to infected animals? Is it through their food? Is it foodborne transmission? Is it house mice, which have been recently demonstrated to become infected with avian influenza? Or was it their owners that gave it to them? These are all questions that we need to answer in order to understand the zoonotic potential of this virus. So let's go to the interspecies transmission, feline to feline. There are 3 studies in the past 20 years that demonstrate probable feline to feline transmission. So the first one is in 2005. It was a tiger to tiger transmission. And then there's also 2 studies demonstrating domestic cat to cat transmission. And this happened in one of them in the United States, in a cat shelter in New York City. And I'm going to talk a little bit more about that study specifically in a few minutes. And then another study in South Korea, which is very recent, in 2023, which was also in a sheltering situation. So you can imagine how worried I am about this virus getting into animal shelters in the US. So feline to human transmission. There have been 3 reports, of this happening. So this happened, there was evidence of 2 humans that shows evidence of seroconversion in the outbreak in zoo tigers in Thailand. So it was the zookeepers. And then also the animal shelter outbreak in New York City. So there was a visiting veterinarian who collected samples from the infected cats. They tested positive for the virus. And then also there was a serological test that was done a little while after the outbreak. And it demonstrated that an animal shelter worker was actually exposed to the infected cats and showed evidence of infection. So feline to human transmission has been documented at least 3 times. How often this happens seems to be quite rare, but it does happen. So it does demonstrate the potential of this virus to transmit from felines to humans, which is one avenue that could spark a pandemic. So if we look more closely into the outbreak in domestic cats in New York animal shelter, one of my close colleagues, he's the second author listed there, Bill Lindsley from CDC NIOSH, him and his team and also ASPCA went to a cat quarantine facility that was made as a result of this outbreak to do some testing. And what they found was culture positive air and surface samples from the cat quarantine facility. So this demonstrates, and what I mean by culture positive is, I mean actual live virus floating in the air and on the surfaces inside of that facility. So this demonstrates the potential for airborne, which is the inhalation of aerosols or particles, viral particles, and indirect contact, so fomite mediated touching surfaces, touching your nose or mouth. So that study is very important. And I don't think there's any other study in the world that I'm aware of, at least not in the past 20 years, because I've scoured the literature that has demonstrated this. So this is something it's quite alarming to know that there's potential for airborne transmission of this virus from animals to humans, and especially felines who have a very, very close relationship with humans, because it just is an indication that this could happen at any time and we're not monitoring it. That's the scary part, is that we're not monitoring it. But once we start monitoring it and start finding out the unknowns start turning into the knowns, then the scare factor goes down. But importantly, in this situation as well, the number of cats infected, there were, I think, 3 publications on this specific outbreak. The number of cats infected was not reported. So these are not included in the counts in our literature review. And my guess is that there were a substantial amount of cats impacted here. So again, our numbers are largely underestimates of the real world of what's really going on out there. So let's move on to prevention. So this is one of my recently adopted kittens, Blaze, and he is asking us, what are you gonna do to protect me from this scary virus? So I outlined 4 main points that you all can do to protect yourselves and your pets from bird flu. So number 1, do not touch or allow your pet to touch sick or dead animals or animal droppings. Transmission doesn't always occur through the animal flesh. It can happen through the animal droppings. So if you see your dog or cat sniffing around some other animal's poop, make sure you say, no, leave it, because that's one way that it can be transmitted. Okay, number 2, do not consume or feed your pet raw meat or milk. We know for sure that cats are being infected through consuming raw milk. They could be being infected in other ways, but we know that that's at least one of them. So do not feed them raw milk. And you yourself should not consume it either. Okay, number 3, keep a close watch on free roaming outdoor pets. So I understand that not everybody can keep their pets inside. Some people like to allow their cats to roam their yard freely. Me growing up, I had several cats. Most of them were indoor, but we did have one particular cat that we would let in and out. So he was an indoor and outdoor cat. Um, if you have a cat like that or a dog, make sure that you keep a close watch on them. And I know that's difficult because cats, they go very far, and a lot of times you don't know where they go. But if you can, as much as you can, keep a close watch on your free roaming outdoor pets, just to make sure that they're not getting into things that they shouldn't be getting into, like in point one, a sick or dead animal or animal droppings. And then number four, immediately report rabies-like symptoms to a vet. So if you see any unusual symptoms in your cat or dog after, maybe not even after coming in contact with a sick or dead animal or animal poop, any type of rabies-like symptoms, report it to your vet right away. So those were my main four prevention steps. Now, how about my follow-up research plans? So what I plan to do with my PhD student, Ian, and also in collaboration with our larger partner lab, the Public Health Aerobiology Lab, and also the Department of Veterinary Medicine here at University of Maryland, College Park. We want to partner with animal shelters and rescues to help start an avian influenza virus knowledge network. So we want to help the shelters monitor their pets and even their workers and their facilities. Similar studies to what my colleague did in 2016 during the avian influenza outbreak in the shelter in New York. Very similar studies to that, where we want to, as non-invasively as we can, measure the potential exposure of this virus to the pets in the facility and also the workers, because I'm very worried about this virus getting into shelters. It could be devastating if it evolves in a way that can easily transmit from cat to cat. We know that it can because it's been documented before, but we just don't know how readily it can happen in a situation where there are a bunch of cats together in a sheltering situation. So we want to focus on the cats. We can include dogs. I think that we will. They are just seemingly less vulnerable to this virus. And the workers. So if the shelters have volunteer workers or paid staff that work and handle the animals, like the frontline workers that are in contact with the animals, measure their exposure as well. If we detect potential antibodies in the cats as well as the humans, then we've demonstrated that that is an occupational hazard. And if the situation becomes dire and urgent, we can try to get the government to provide safety equipment, so personal protective gear, like during COVID, where you could wear a face mask if you're comfortable wearing one on shift, just as a precaution. So those types of things, this research can inform. And then also the facilities. So taking some surface swabs and some air samples. You're probably wondering, how do you take an air sample? So we have these small devices that we can set up in the corner of the facility or even hang it from the ceiling, where we can just collect air samples. It's kind of like you set it, forget it, let it go for 4 hours, and then we come back and just collect it, and then we monitor, we test it in the lab if there's anything circulating in the air. And then also we would like to partner with zoos to monitor exposure in big cats. Now this is extremely difficult because we would have to partner with the veterinarians who work with the big cats. But the idea would be to hopefully be able to monitor, be able to take a sample or an aliquot of an already of a blood sample that's already been taken from the felines. So an example would be when when you intake the kitten or a cat into the shelter and they do their tests for FIV. If we could just have a small sample of that blood that's already been taken and test that for antibodies, that would be perfect. Because we don't really want to have to take an additional sample because we don't want to do that invasive sampling. We don't want to be invasive to the animals. We just want to sort of monitor and do an observational study and hopefully be able to monitor samples and look into the things that have already been collected. So that's the idea. We've contacted, I think it's 52 or more shelters and rescues in the DMV area. So we first want to start local. So if anybody is on the chat from any of those organizations and you receive the emails from our undergraduate research assistants, please email me if you are interested in working together and learning more about our research. There will, of course, be compensation for volunteers that want to participate, but please email me. And I'm also interested in collaborating outside of the local area. So if there's anybody, I know that this is hosted by the New England Fed. So if there's anybody in Massachusetts or anywhere else that would like to collaborate, let me know. You might already be collaborating with some of my colleagues who I am getting to know and learn more about their studies. They're also interested in avian influenza in cats. And so we're going to put our heads together and see, what makes sense to do, which shelters and rescues would make sense to partner with. Should we focus on shelters that are near cattle farms, or should we focus on both and see if we can do a comparative study? So those are all questions that we're working out. But in summary, the main goal is to help the shelters out. And because largely, like I mentioned before, clinics, regular veterinary clinics, they don't have the capacity to test for avian influenza virus in felines. So that is something that our laboratory will have to do, obviously free of charge, to help understand, are these kittens being exposed? Are they vulnerable? Or is this not an issue that we need to be concerned about at the moment? So these are all questions that we're trying to answer. So lastly, I just want to say thank you to my funders that have funded me thus far. This is a new endeavor of mine, so just started in probably May and this summer. So the UMB Institute for Clinical and Translational Research, that's at the University of Maryland School of Medicine, and also the Department of Global Environmental and Occupational Health, which is a brand new department that we just launched and opened recently. The director is Dr. Amy Sapkota here at the University of Maryland College Park. And also the flu lab. They gave a gift to my partnering lab, public health aerobiology lab, to give to somebody, and they decided to gift it to me. And I'm going to use that money to kickstart this research and start fostering collaborations with the nearby shelters. And you're probably wondering who these cats are. This top one here, this is my cat Queenie. She is actually from the Toledo, Ohio area. That's where I originally grew up. One of my colleagues, she had mentioned to me, I think she put something on Facebook. She said, if anybody needs a cat, I have 3. I guess there were 2 young boys that dropped 3 kittens off in a box on the street in front of her home. So she was fostering them. I decided to take all 3 of them in. I eventually found an adopter for 2 of them, who was my handyman. So that worked out really well. But I decided to keep Queenie. She's so cute. I think she's a snowshoe Siamese kitten. And then my other cats, I have the triplets. I don't know if you saw the picture of the three kittens, but I also fostered them this summer and adopted them. And I have another cat, Tuna, who I found in my parking garage. So those are all my kittens. And soon to be full-grown cats in a few months. But you can see that I really am passionate about feline health, and I'm really worried about this virus getting into animal shelters, and I'm trying to do all that I can to prevent that from happening, and try to prevent it from causing devastating effects. So thank you everyone for your attention, and I'm be happy to answer any questions you have.
Okay, well, I definitely have a bunch of questions that I've put together from people here. We just kind of start at the end and work my way up. Someone is asking, at what point symptomatic state, post-mortem, caretaker testing, etc., in the literature have you seen large felines being tested for FIV?
For FIV, I I don't think we didn't look in the literature for FIV. Our literature
Okay,
was for avian influenza virus, so I
maybe
don't,
that's what they mean.
maybe that's what they mean. I'm not sure. So I guess if I understand the question, is it written down here? Okay,
Yes, it
postmortem
is. It's in the chat.
in the
It's
literature.
the latest
Oh,
question.
okay. So that's not something we focused on, but that is a good question. So I do know that most avian influenza testing is postmortem.
Okay. The next question is if you know if the state veterinary labs are routinely testing for avian influenza in animals like they would with a cat that's also suspected for rabies.
So as far as I know, no, which
Mm,
is something that I think should change and might change soon. Um, because there is at this time no surveillance network or effort to routinely test cats and dogs for this virus.
Okay, that brings me to a question that I had, which is asking if you're working with the University of Minnesota, who apparently is creating something called the Companion Animal Veterinary Surveillance Network to
Yes,
monitor small animal and horse diseases.
yes.
Do you
So
know about them? You working with them?
yeah, so I just met Dr. Cardona, I think it was a few weeks ago, and she invited me to be on her study section. She might even be in this talk. In Yep, she's there. Carol Cardona, yes. So we are going to meet after this this week and discuss routes forward. But yes, I'm familiar with that group, and I plan to work with them. Thank you.
Great. The next question is kind of related. Are you working with the Association of Shelter Veterinarians?
No, but that is a good organization that we would like to reach out to.
Okay. Someone has asked if you can clarify what you mean by raw chicken feed. Does this mean feeding raw chicken derived protein to chickens? What implication could this have for veterinary clients who are feeding raw food diets to their pets?
Right. So yes, that is what I mean. Feeding raw chicken to directly to cats. You shouldn't do that, especially not now in this situation. So the implications for people who do feed their pets raw diets, um, I guess you would probably want to know specifically where you got the raw food for, but there's really no way to confirm whether the raw meat is contaminated with avian influenza unless you test it.
Mhm.
But and I understand the benefits of having a raw food diet, but I think at this point in time, especially now, what we're seeing in the United States with the dairy cattle situation, I would refrain from that, or try to cut down on the raw food diet.
Would you make a differentiation there between a raw food that somebody is out obtaining on their own, or one that they basically are buying commercially?
Okay, well, there's no evidence that raw chicken in the United States grocery stores is contaminated. But I don't know if it has been tested. Because normally, we would cook it before we ate it. So we wouldn't experience the illness, but the cats might. But I think that there's obviously more regulations with the meat that's sold in the grocery store. Whereas if you're going out and getting it from a backyard flock, that's a little bit more risky because it's not going through the food chain, and there's not as much regulation there. And especially if the flock that you're getting it from is a free roaming flock that has exposure to wild birds, especially wild
Okay.
migratory birds.
Okay. A question that was asked is, what does post-mortem avian influenza testing include?
Mostly, at least from the studies that I've read, they would do a PCR test. So
Okay.
PCR test is similar to the COVID test that everyone is probably familiar now, the nasal swab that you get at the doctor. So they would test a bunch of animal fluids through the PCR. And then sometimes what they'll do is also a serology test. So they'll test the blood and tissue for antibodies to test for a previous exposure.
Okay. I actually had a question on, is there any kind of data on the length of transmission from exposure to actual illness?
So the incubation period for avian influenza virus and felines hasn't been reported, but I do know that in one instance there has been a case of a cat who actually survived for 10 days. So normally the felines, the first indication that they have avian influenza, the virus, the illness escalates so quickly, and it's like it's rabies, that they euthanize. Whereas in one case, there was a cat that actually survived for 10 days. Now, how long that cat could have been contagious during that period is unknown. But, and then the incubation period is relatively unknown, but I think that it would probably depend on the route of infection. So whether the cat drank the milk, I would assume that it would probably be pretty quick. Whereas if it's got into their respiratory tract, it might be a little bit slower.
Okay. We have a question from our participant from as far away as possible in Pakistan. Welcome. And they are asking, do you plan to expand your follow-up research internationally? How are you planning to collect non-invasive samples, and what sample types are you thinking about?
Okay. So yeah, that would definitely be a long-term goal, is to expand this internationally. I do have experience in global health. I lived in Singapore for about 5 years, and I did respiratory virus research all around Southeast Asia. So where we would target, I'm not sure. Perhaps Pakistan would be a good place to start. But yeah, definitely would want to expand globally. I am in the Department of Global Environmental and Occupational Health, so that's definitely a long-term goal of mine. And in terms of non-invasive sampling, what I mean by that is largely the environmental samples. So collecting air samples and surface samples, perhaps feces samples. So that would be non-invasive, where we don't have to collect a sample directly from the animal. But I think that we would still, as we start out, we would still need to collect samples from the animals to see how well the non-invasive sampling compares to the invasive, more invasive sampling. Can we rely on just an air sample or a surface sample or a feces sample to tell us if there's exposure or an outbreak in a certain environment? Or do we really need to rely on the animal testing?
Okay. And a question that really impacts a lot of those of us who work in shelters. Given the shelter outbreak of H7N2 in New York and the detection of the airborne transmission and spread to humans, do you recommend that people wear PPE when handling cats in shelter settings?
Yeah, so that is definitely something I would recommend um, as a precaution, sure. I don't know about at this point because we have not seen the virus in animal shelters in the US after that incident, as far as I'm aware. But I think that there will be a point in time that we can kind of trigger that guidance where we say, okay, the virus is now showing up in shelters. You should probably wear PPE.
Mhm.
But I think at this point, the risk is still very low. But that could just be because we are unaware of what's going on.
Possibly looking at that map where you saw some hot spots. A follow-up question was, has there been any follow-up to the H7N2 outbreak that shows that it has actually ended?
Oh, yeah, so this was in 2017. And I don't know what they did to confirm that it was over, but I do know that they had a specific cat quarantine. So they would move the cats to they would separate it from the shelter until the outbreak was over. So I'm not sure about any continued surveillance, if that's your question. I don't think there has been continued surveillance.
Mm,
So H7N2, could have wound up in other shelters in the country. We just are unaware of it.
I think those are the main questions. There were some comments that people did have in the webinar about where people can get uh, poultry and things that have been tested, basically buying it in the grocery store, etc. Um,
Yeah, I think that at this point, there's no indication that the raw chicken meat in U.S. grocery stores is harmful.
mhm.
Um, I would just reiterate that the risk is probably higher if you're getting it from a backyard flock.
Yeah. Another question that came in, if you're interested in engaging with shelters that run a companion animal shelter center and or a wildlife center.
Um, I both. So our primary interest is the shelters.
Mm,
But we also are interested, like I mentioned, in the endangered species that are being infected. So we do want to partner eventually with zoos, and wildlife centers would be definitely part of that.
all right, terrific. Thank you so much.
Well, thank you so much, Kristen. Thank you, Vanessa, for running those questions through. And thank you to all of the attendees with these fantastic questions today for Dr. Coleman. This has been an amazing session. I know I gained so much insight um, to this whole topic that I was not aware of. So I really appreciate your coming out today. I would love to just remind everyone that we have registration for our conference opening soon in the coming months. So keep an eye out for that. The conference again will be in Burlington, Massachusetts in March. And check out our website to register for next month's webinar on panleukopenia. And we, again, appreciate you all for being here today. And Dr. Coleman, thank you so much for sharing your expertise. We appreciate your time, and have a wonderful day, everyone.
Thank you.